Has to do with administrative uniformity. As a provider, one of the most difficult things is knowing where to submit, what to submit, and the state of Minnesota, for people who are covered under insurance plans that are mandated by the state of Minnesota, has formed an administrative uniform committee so that a certain CPT code is going to result in coverage by all of the health plans in the state of Minnesota. A majority of the people in Minnesota, however, are covered under what are called ERISA plans, which are federally governed. In other words, General Mills, 3M are self-insured, and those are covered under federal mandates. Is the health reform that is being talked about in Congress going to mandate administrative uniformity?
As Kevin had some, it was Kevin, right, sir? Your first name is Kevin?
Nick.
Yeah, Nick, I'm sorry, I wrote it down. As Nick had some really good suggestions, a lot of the things that you have spoken to, we've even heard from the insurance companies, and they say that they're ready to come to the table and work towards more universal codes. And I think that that's something that's very, very achievable and will reap a lot of cost savings, and also keep more people working on the floors and in the wards, and more time with patients and less time doing paperwork. So that is one of the goals we're working on. Thank you for sharing that.
My name is Lydia Karras. I'm a pediatrician and I live in St. Paul. And thank you very much for everything you said tonight. It's very heartening to hear what you have planned. My concern, I'm totally in support of healthcare reform, and I'm hopeful that there's so many people interested in so much going on about it. But I have to admit, I'm really frightened about what seems to be the lack of leadership in the Democratic Party about this. We are hearing so much from the Republicans, and I'm very concerned that there isn't enough leadership from the Democrats about what it is you're going to do or how it's going to be done. And it's sort of no wonder that people are just rambling around without anything clear about it, because it hasn't been enough clearness from those of you that we support and who we work to be in office. And it's just very disappointing and a little scary to think that the Democrats aren't really standing up and being strong. Thank you.
That's something that I heard on and off this summer, and I heard some of that in our meeting in July. What we are doing is we're legislating, and that means that the Democrats are going back into their congressional districts, they're holding hearings, they're getting reaction from some of the various plans, and really listening careful to go back and write meaningful legislation. So there's an A bill, as some would lead you to believe, that's out there. And so we're trying to do this in a very thoughtful way, but there are many on the other side of the aisle whose goal is to stop healthcare reform altogether. And so the more misinformation, the more fear that they can put in the hearts of people, the more distrust that they can make happen to defeat healthcare reform. That's what they're going to try to accomplish. We're going back in September. We're going to be attending caucuses. We're going to be sharing what we heard at our different town hall meetings. I'm going to make sure that your voices and your concerns are heard. And then you're going to see bills moving forward with specifics in them. And then we'll be communicating back to you on those specifics in the bill as we move forward. But I thank you for your comment. And legislating is sometimes not very easy. But I believe it's important that we take our time to do it right. Thank you for your comments.
Uh, 177 and 30 and 196.
Congresswoman Tom Nordine, live in your district. moved here about 10 years ago. I was listening with interest to your enthusiastic, your interest in that we would turn out, we would come and express our opinion, and how you were looking forward to hearing our comments. I had to remind myself that had your party had the votes a month ago, there would have been no input from anybody. You guys would have rammed it through without any discussion, without even seeing the bill on the internet. And I've been hoping, I'm a self-employed small businessman, I've been hoping for reform for years. Reform is would result in lower cost. Reform would result in competition. This bill is more of the same. It's more government, higher cost, and less choice. And so I am for reform. This is not reform. We've been having, the government's been taking more and more of the healthcare industry up right through the last several administrations. And this trend continues, and now Obama, my president, has decided to take total control of it. We need to go in the other direction and give freedom back to people to decide who they want to be their healthcare provider. We have to get rid of mandates that would cause me to take on coverage on items that I would have no interest in. This national health care that's being pushed would cover me from maternity benefits. I've got 8 grandchildren. I don't need maternity benefits. There are so many mandates that raise the cost of health insurance. Take those out, allow smaller companies to come into the state, allow the insurance to be portable. When you leave your job, you can take it with you, like the gentleman said before. Let each person get a cash amount from their employer and let them go around and buy their own health insurance instead of having to take it from their employer. Thank you very much.
Well, I appreciate you sharing your views. However, there was no piece of legislation that was being rammed through anywhere. I know that. Ladies and gentlemen, when you speak to me, you have my sincerity, but I'll listen to you with respect. I serve in Congress. I was there. There was no piece of legislation that was being rammed through. There was a lot of discussions. There was a lot of things on the internet. I listen to CNN, and I don't know where the heck those guys are getting their news, and some of the other places, some of the times, it's just amazing what I hear on there. I'll have left a hearing. So please, you might disagree with me, but it's a true statement to say there was no legislation that was in any urgency of being voted on. That's why we came back this summer. That's why I had a meeting in July. There's not even a bill in the Senate. This is not going through gangbusters. And in my remarks, I said it might not even happen. So please, I like your comments about portability. I hear that a lot, especially from small business owners. And it's something that I really believe that it's something that we need to work on. The question about mandates and maternity care, I would say that I think that if we're going to have health insurance, and health insurance when it's sold in Minnesota, make sure that women's health care needs are addressed. And I have to say I might be a little biased there, being a woman, but I'm going to make sure that women's health care is protected and maternity coverage is protected under anything that moves forward.
Hi, my name's Bonnie, and during August I was reading parts of Bill HR 3200 because I was hearing such conflicting things on TV. You listen to one channel and say one thing, and you listen to another channel and it was conflicting. So I started to read parts of the bill, and I was kind of surprised to read the grandfathering clause that really, when I read that, looked to me like I would not be able to keep my health insurance. Maybe for a year, maybe a little bit longer, but with the way that it talks about grandfathering, and if there are any changes in your plan, that you would then have to go into the public option. And I guess my other question is I guess whatever we, the people, are going to be put on, I guess I would like to